Hi, my name is Catalina Garcia here at Florida Bariatrics and Wellness, and today I would like to introduce Dr. Rodriguez.
Hello.
We'll be talking today a little bit about some protein shakes and some protein bars that we do offer here at the practice, and Dr. Rodriguez is going to give us a little bit of knowledge. So, Dr. Rodriguez.
Well, thank you again for having me. And well, we always talk about proteins in our information that we have either written or in the internet. We always talk about getting a little bit more protein in your diet and decreasing the amount of carbs and sugars. In order to do that, we need to read labels. I mean, there's a lot of information in here that is pertinent, and what I always focus on is, again, making sure that the servings and the amounts correlate, meaning that sometimes you get a little bar and it says that it's 2 servings, so you have to multiply everything by 2, basically, or sometimes the numbers are accurate. Then what I look at is the amount of carbohydrates and the amount of sugars. And in this particular one, it's pretty good because it has 4 grams of carbohydrates, of which 2 grams are of fiber. So basically the amount of sugar that you're taking is 2 grams, which for this packet is pretty good. Then I see the amount of protein per serving, and this one has 15 grams of protein, which is, again, pretty good because when you're aiming somewhere between 60 and 80 grams of protein as a minimum on a 24-hour basis, you have to divide that in about 4. So we're talking between 15 and 20 grams of protein every 4 hours or so. So this one is a good replacement for that because you get 15 grams and you have a minimum amount of sugars. So those are the things that we look for. Obviously, there's a lot of variety. After you have good quality, then you can choose the flavor. You have good quality first, and then you can choose the flavor that that you enjoy the most.
And a question, and how do you know how much protein to intake?
So it depends on your body. I would say that that's a very difficult to adjust when you're in a weight loss process, because technically the more you lose weight, the least amount you would need with time. Mm-hmm. At the same time, there's calculations depending on your weight, which ideally you calculate your ideal weight. And there's a bunch of formulas on the internet that you can input your metrics, and then it will give you the exact amount. But in general, like I said, between 60 and 80 grams of protein, that seems to encase most people. Some people will need a little bit more, some people will need a little bit less. But I think that there's a very good start point, and then you can start trimming it up or down depending on what your goals are.
Okay. We do have these bars that we sell here at Florida Bariatrics, and I have these that are from the store bought. Which ones do you think are better for our patients?
Well, I mean, as a rule of thumb, if it's too good to be true, usually it's not. All right? I mean,
these are a cake.
Yeah, when we're talking about weight loss, you usually don't use cake in the same conversation. So, when I see these, I just get a little bit skeptical. I'm sure there's a lot of good intentions behind it, but at the same time, this kind of defeats what we're trying to do. This, we have 20 grams of protein, but then when we go in the back, we take a look at the sugars, and that's when 25 grams of carbohydrates. That's a little bit.
What's a good number for carbs?
I mean, less than around 12, I would say, is a good for 1 serving. If you look at this, it's about 10% of the daily value. So we're talking about 250 grams a day diet based on this requirement. That's a little bit more than we were trying to do. So if you can keep it, below 200, mm-hmm. even better. So if you divide that again in 3 or 4, we're talking about less than 20 grams per serving. Now, if you add fiber to that, so fiber are the good carbohydrates, right? So that you can subtract that from the total amount. So this one doesn't have any fiber. So basically all the sugars are sugars. So
and also it has, I always look at the sodium.
correct.
What is good sodium? Because I say like 100,
Yeah,
but sometimes like 250 to
Correct.
something.
so the problem with sodium is that sodium attracts water, right? So the more sodium
You'll retain the water.
you retain water, and that swells you up, increases your weight.
Yeah, no, we
Also,
don't want that.
that's the same thing with your blood pressure. You know, if you're ingesting a lot of sodium, that will increase your intravascular volume, increases the blood pressure. So keeping again, there's some studies that suggest that it's not as important as we thought it is, but you know, you don't want it to be on one serving more than 20-30% of your daily allowable, because then you have less amount that you can ingest after that. So all these numbers are important. I'll go in order. The first thing I look at is the sugars. The second thing I look at is the amount of protein, because I want to make the most out of what I'm eating. And then I look at the other factors, including the sodium, cholesterol, saturated fats, and things like that. But for the most part, correct. If you're keeping it below 10% of the daily amount, I think
You will be good. Okay, great.